I remember a case of a 16-year-old boy who presented with his 10th documented recurrence of rheumatic fever. He'd had 10 episodes. And on the 10th episode, which occurred in fact on his 16th birthday, he died of overwhelming heart failure. Those are the sorts of cases where you see there's a young person who's got a disease that's not of their making. It's largely as a result of the horrendous living conditions they're born into, and that despite those living conditions should be able to be managed, and yet hadn't been.
Childhood is the time that we tend to feel is for a carefree life, for going to school, for development. And here we're seeing children with an acquired heart disease that really affects their lives quite severely. So they're unable to go to school, unable to have a normal childhood, and more importantly, in this day and age, unable to prepare themselves for an economic future. Often a very well child or well-looking child that is, struck down by such a significant disease, and then either requiring surgery or lifelong medication, certainly does impact upon one. So really in South Africa, it is very much on the heart of any cardiologist or pediatric cardiologist working in the country, simply because we see so much of it, and much of it affects children and young adolescents and young adults.
To have, even if it's only one sick children with a chronic disease such as rheumatic heart disease, completely changes their lives. They have to spend a lot of time with these children, children who have the disease, taking them to hospitals, which are usually very far from their homes, which means that usually they have to stop working to take care of the child that has rheumatic heart disease. And although we think that the children do not feel, some of them report and tell us as doctors, I don't want to come anymore because I'm being a very high burden to my family.
So I've seen the full spectrum of the tragedy that visits people with rheumatic heart disease. And it was not just one isolated patient, it was a repeated exposure to many such tragic tales. I've seen pregnant women finding it very difficult to go through a pregnancy because their valves were diseased. And either they had to be operated, sometimes losing their baby, or they lost their own lives in a very difficult childbirth.
Although people have known about heart disease, know about rheumatic heart disease to some degree, the actual awareness has sort of lessened over years because awareness campaigns have gone into other things that seem more pressing or more important, especially in the infectious diseases spectra. So people are not as aware of it as they used to be before, and that obviously also impacts upon the way they treat the disease.
In general, the health professionals do not know much about rheumatic heart disease, because the program at the School of Medicine is probably not insisting enough on that.
We must make sure that rheumatic heart disease is not forgotten by policymakers, by health professionals, by those who fund health programs. Because when multiple diseases compete for attention, including in heart disease, it is easy to forget that the poor still suffer from rheumatic heart disease.
We know that this is a very important disease in our population, because from working in hospitals, we assist a lot of children and young adults with rheumatic heart disease. Either they are breathless, or they have pain in their joints, or they have fever. So usually they have long periods of admission. And when you consider these 5, 6, 10 times for a kid that is growing up to 18 or 20 years, and will then need a surgery, that will put even more burden on the health system, we can say that we consider that this is a disease with a very high burden on the health system in every country where it is endemic.
probably around 30% of my patients have rheumatic heart disease. And they are challenging because most of those I have to take care of need surgery.
We estimate that right now a minimum of 15 million people have rheumatic heart disease. That's probably a dramatic underestimate. About 300,000 or more die each year as a result of rheumatic heart disease. And we get a similar number, 250, 300,000 new cases each year. Now this is not a minor disease, this is a really important disease, particularly if you think about the people who are affected. Children, young adults in their most productive years, and if you also think about it as a disease of poverty and a disease that is in its essence incredibly easily prevented.
Even in these poor countries, we need to make an extra effort to bring the attention of diseases like rheumatic heart disease to the general public, to the leaderships, etc. So I think that every effort, every help that can be given to social networks dealing with the disease, to health communities, to health centers, etc., is very welcome. And I invite everyone who is interested or touched by one or other story of a kid with rheumatic heart disease to join efforts and to try to help countries like Mozambique who are struggling to get programs running to control this disease.
One cannot quantify how having a chronically ill child or a young adult who's no longer able to work or who has no prospects for work can affect a family and therefore a community. And I think this is something that's completely preventable by something that's actually been proven and is relatively simple and cheap. And we really should do everything we can to not see it ever again.
Rheumatic heart disease programs can be done really cheaply. So what's the obstacle? The obstacle is people understanding this. The obstacle is people deciding to make it a priority and then having some ability for them to get the right advice about how to do it. There's no doubt that the dollars should not be an obstacle because it's not big dollars.